So who is Lydia Hall? Lydia Hall was born on September 21, 1906 in New York City as Lydia Eloise Williams. She was the firstborn of Louis V. and Anne Ketterman Williams and was named after her maternal grandmother. Her brother Henry was several years younger. When she was very young, her family moved to York, Pennsylvania, where her father was a physician in general practice. After graduating from York Hospital School of Nursing in 1927 with a diploma in nursing, Hall felt as if she needed more education. She entered Teachers College at Columbia University in New York and earned a Bachelor of Science degree in Public Health Nursing in 1932. After a number of years in clinical practice, she resumed her education and received a master's degree in the teaching of natural life sciences from Columbia University in 1942. Later, she pursued a doctorate and completed all of the requirements except for the dissertation. In 1945, she married Reginald A. Hall, who was a native of England. She began her prestigious career in nursing as a graduate of the York Hospital School in Nursing in York, Pennsylvania. As I mentioned earlier, she earned her BS and MA degree from Teachers College, Columbia University. Hall held faculty positions at the York Hospital School of Nursing and the Fordham Hospital School of Nursing, and was a consultant in nursing education to the nursing faculty at the State University of New York Upstate Medical Center. She also was an instructor of nursing education at Teachers Education. Hall's career interests revolved around public health nursing, cardiovascular nursing, pediatric cardiology, and nursing of long-term illnesses. She authored 21 publications, and the bulk of the articles and have addressed regarding her nursing theory were published in the early of middle 1960s. In 1967, she received the award for Distinguished Achievement in Nursing Practice for Columbia University. Hall's greatest achievement in nursing was her design and development of the Loeb Center for Nursing at Montefiore Hospital in New York City. The Loeb Center opened in January of 1963. Hall designed the 80-bed Loeb Center for persons aged 16 years or older who were no longer having acute biological disturbances. Candidates for the Loeb Center were recommended by their physicians and had favorable potential for recovery and subsequent return to their community. Within the non-directive setting, patients demonstrated success and provided empirical evidence to support the major concepts in Hall's theory. In year 2000, the 80-bed Loeb Center continued to be a vital part of Montefiore Medical Center. The skilled nursing facility provided a team approach to assist hospital patients who had chronic disease or were recovering from an acute illness or surgical procedure. The range of conditions that patients at Loeb's experience remains fairly consistent to original patient population, which include diabetes, cerebrovascular accidents, postoperative heart surgery, hip fractures, amputations, and arthritis. The rooms were arranged with patient comfort, maneuverability as a first priority. The patients also had access to a large communal dining room. The primary caregivers were registered professional nurses. Non-patient care activities were supplied by messenger attendants and ward secretaries. The center's philosophy, as stated by Bauer Ferras, was as follows. Loeb's primary purpose was and is to demonstrate that highly quality nursing care given by registered nurses in a non-directive setting offers a supportive setting to people in the post-acute phase of their illness that enables them to recover sooner and to leave the center able to cope with themselves in what they may face in the future. To create a non-directive setting, there are very few rules or routines, no schedules, and no dictated meal times or specified visiting hours. The nurses at Loeb strive to help the patient determine and clarify goals, and the patient work out ways to achieve the goals at the individual's pace consistent with the medical treatment plan and congruent with the patient's sense of self. At Loeb Center, the nurses were in charge, and Hall, as director of the center, hired and fired the physicians who were employed there. Hall drew extensively from the schools of psychiatry and psychology in theorizing about the nurse-patient relationship. She was a proponent of Carl Rogers' philosophy of client-centered therapy. This method of therapy entails establishing a relationship of warmth and safety and conveying a sensitive empathy with the patient's feelings and communication. A major premise Hall borrowed from Rogers is that patients achieve their maximum or maximal potential through a learning process. Hall also advocates the Rogerian therapeutic approach. This approach is the use of reflection, a non-directive method of helping the patient clarify, explore, and validate what he or she says. Rogers states the therapy's procedure which had found most helpful was that the therapist clarified and openly stated feelings which the client had been approaching hazily and hesitantly. Hall derives postulates regarding the nature of feeling-based behavior from Rogers, who repeatedly speaks of the interaction of known feelings and feeling out of awareness. Rogers hypothesized that in a client-centered relationship, the patient will reorganize himself as both the conscious and deeper levels of his personality in such a manner as to cope with life more constructively. He shows more of the characteristics of the healthy, well-functioning person. He is less frustrated by stress and recovers from stress more quickly. Hall also adopted Rogers' theory in motivation for change. In this theory, Rogers asserts that although the therapist does not motivate the patient does not supply the motivation either. Alternatively, motivation for change springs from the self-actualizing tendency of life itself. Hall also integrated educational and interpersonal theories into her theory. And lastly, Hall developed her ideas regarding interpersonal behavior from Harry Stock Sullivan and also used teaching and learning ideas integrated from Jean Dewey. The influence of Dewey is evident in Hall's emphasis on the teaching learning process with the nurse's primary responsibility as being the teacher. Sullivan's influence was evidenced in the role of the nurses as nurturers for the patients within the core circle. So what are the major concepts and definitions on the care core cure model of Lydia Hall? Clearly, the first one is behavior. Clearly, Hall broadly defines behavior as everything that is said or done. Behavior is dictated by feelings, both conscious and unconscious. The second major concept is reflection. Reflection is a Rogerian method of communication in which selected verbalizations of patients are repeated back to them with different physiology to invite them to explore feelings further. The third one is a self-awareness. Self-awareness refers to the state of being that nurses endeavor to help their patient achieve. The more self-awareness persons have of their feelings, the more control they have over their behavior. The fourth major concept are the phases of medical care. Hall divides medical care into two phases: biological critical and evaluative follow-up. Biological critical medicine lasts a few days to a week or more, and is the period when physicians devise treatment plans that help the patient reach the second phase. During this the first phase, the patient receives intensive medical care and multiple diagnostic tests. On the second stage illness, the patient enters the second stage of medical care once the doctors begin giving only follow-up care. Hall defines second stage illness as the non-acute recovery phase of illness. This stage is conducive to learning and rehabilitation. The need for medical care is minimal, although the need for nurturing and learning is great. Therefore, this is the ideal time for wholly professional nursing care. And last major concept is the wholly professional nursing. Wholly professional nursing implies nursing care given exclusively by professional registered nurses educated in the behavioral sciences who take the responsibility and opportunity to coordinate and deliver the total care of their patients. This concept includes the roles of nurturing, teaching, and advocacy in the fostering of healing. Nursing circles of care, core, and cure are the central concepts of whole theory, as you can see on the figure. Care alludes to the hands-on intimate bodily care of the patient and implies a comforting, nurturing relationship, while intimate physical care is provided. The nurse and patient develop a close relationship representing the teaching and learning aspect of nursing. Core involves the therapeutic use of self in communicating with the patient. The nurse, through the use of reflective technique, helps the patient clarify motives and goals, facilitating the process of increasing the patient's self-awareness. Cure is the aspect of nursing involved with administration of medications and treatments. The nurse functions in this role as an investigator and potential cause of pain related to skills such as injections and dressing change. Since this is a Facebook page of Lydia Hall, I uploaded pictures such as the picture of Lydia Hall. The second picture is the Columbia School of Nursing in New York. The third picture is the Montefiore New York Hospital. The fourth is the Loeb Center. The fifth picture is the Three C's of Lydia Hall, the Care, Core, and Cure. And then the last picture is also the Three C's of Lydia Hall, which is the core, which is known as the person, the therapeutic use of self, the body, which is the care, the intimate bodily care, and the disease, seeing the patient and family through medical care, which is known as the cure. When I started my research, I found out that the central theme of Lydia Hall's theory is that it focused on rehabilitation, encompassing nursing autonomy is the therapeutic use of self-treatment within the healthcare team, which is the cure circle, and nurturing, which is the core, which is the care circle. So what is the purpose of Lydia Hall's theory? It is to provide wholly professional nursing care to people who pass the acute stage of illness. So let's move on Lydia Hall's theory of nursing. Lydia Hall presented her theory of nursing by drawing three interlocking circles, each circle representing a particular aspect of nursing: care, core, and cure. Hall enumerated three aspects of person as the patient: the person, which is the core, the body, the care, and the disease or the cure. These aspects were envisioned as overlapping circles that influence each other. Hall clearly stated that the focus of nursing is the provision of intimate bodily care. She reflected that the public has long recognized this as a belonging exclusively to nursing. Being expert in the area of body involved more than simply knowing how to provide intimate bodily care. For her to be expert, the nurse must know how to modify care depending on the pathology and treatment while considering the unique needs and personality of the patient. Hall conceptualizes nursing as having three aspects and delineated the area that is the specific domain of nursing, as well as those areas that are shared with other professions. Hall believed that this model reflected the nature as a professional interpersonal process. She visualized it each of the three overlapping circles as an aspect of the nursing process related to the patient, to the supporting sciences, and to the underlying philosophical dynamics. The circle overlaps and changes in size as the patient progresses from a medical crisis to the rehabilitative phase of the illness. In the acute care phase, the cure is the largest. During the evaluation and follow-up phase, the care circle is predominant. So as you see in the figure, it is the three C's of Lydia Hall: the care, the core, and the cure. Let's start on the care circle. The care circle represents a nurturing component and is exclusive to nursing. Nurturing involves using the factors that make up the concept of mothering, which is the care and the comfort of the person, and provide for teaching learning activities. The professional nurse provides bodily care for the patient and helps the patient to complete such basic daily biological functions as eating, bathing, elimination, dressing when providing this care. The nurse's goal is the comfort of the patient. I repeat, the main goal is the comfort of the patient. Providing care for a patient at the basic need level presents the nurse and patient with an opportunity for closeness. As closeness develops, the patient can share and explore feelings with the nurse. This opportunity to explore feelings represents the teaching learning aspect of nurturing. When functioning in the care circle, the nurse applies knowledge of the natural and biological sciences to provide a strong theoretical base for nursing implementations. In interactions with the patient, the nurse's role needs to be clearly defined. A strong theory base allows the nurse to maintain a professional status rather than a mothering status, while at the same time incorporating closeness and nurturance in giving care. The patient views the nurse as a potential comforter, one who provides care and comfort through the laying on of hands. The next circle is the core circle. It is known to be the person. Social science and therapeutic use of self aspect of the nursing. The core circle is based in the social sciences, involves the therapeutic use of self, and is shared with other members of the health team. So the professional nurse, by developing an interpersonal relationship with the patient, is able to help the patient verbally express feelings regarding the disease process and its effects, as well as it discuss the patient's role in recovery. Through such expressions, the patient is able to gain self-identity and further develop maturity. As Hall says, to look at and listen to self is often too difficult without the help of a significant figure who has learned how to hold up a mirror and sounding board to invite the behavior to look and listen to himself. If he accepts the invitation, he will explore the concern in his acts, and as he listens in his exploration through the reflection of the nurse, he may uncover in sequence his difficulties, the problem area, his problem, and eventually the threat which is dictating his out of control behavior. In the core circle, the professional nurse, by use of the reflective technique, helps the patient look at and explore feelings regarding his or her current health status and related potential changes in lifestyle. The nurse uses a freely offered closeness to help the patient bring into awareness the verbal and nonverbal messages being sent to others. Motivations are discovered through the process of bringing into awareness the feelings being experienced. With this awareness, the patient is now able to make conscious decisions based on understood and accepted feelings and motivations. The motivation and energy necessary for healing exists within the patient rather than in the healthcare team. The last circle is the cure circle. It is known to be a disease. Pathological and therapeutic sciences seeing the patient and family through the medical care aspect of nursing the cure. So the cure circle of patient care is based in the pathological and therapeutic sciences and is shared with other members of the healthcare team. The professional nurse helps the patient and the family through the medical, surgical, and rehabilitative prescriptions made by physicians. So during this aspect of nursing care, the nurse is an active advocate of the patient. In this circle, the nurse's role during the cure aspect is different from the care circle because many of the nurse's actions take on a negative quality of avoidance of pain rather than a positive quality of comforting. This is negative in the sense that the patient views the nurse as a potential cause of pain, one who's involved in such actions such as administering injections versus the potential comforter who provides care and comfort in the care circle. So how does the three aspects of Lydia Hall's theory interacts? Because Hall emphasizes the importance of a total person approach, it is important that the three aspects of nursing not be viewed as a functioning independently, but as interrelated. The three aspects interact and the circles representing them change size depending on the patient's total course of progress, as seen in the figure. The core, the body, the core, the care, and the cure interact. It is interrelated. For the continuation of the interaction of the three aspects of nursing, as you can see in the figure, the size of the circle represents a degree to which the patient is progressing in each of the three areas. So the professional nurse at this time is able to help the patient reach the core of his problem to the closest provided by the care of aspect of the nursing. For further explanation, so in the philosophy of lobe center, the professional nurse functions most therapeutically when patients have entered the second stage of their hospital stay. For example, if they're recuperating in or past of the acute stage of illness. So during this stage, the care and the core aspects are the most prominent and the cure aspect is less important. So like I said earlier, the size of the circle represents a degree to which the patient is progressing in each of the three areas. As you can see, the core circle is larger than the care and the cure area. The cure circle is less prominent. Unfortunately, I think in today's managed care environment, all too often this stage occurs post-hospitalization and the patient access to nursing care is very limited. Halls places the motivation and energy needed for healing within the patient. This aspect of our theory influences the nurse's total approach to the six phases of the nursing process: assessment, diagnosis, outcomes, planning, implementation, and evaluation. The assessment phase involves collection of data about the health status of the individual. So according to Hall, the process of data collection is directed for the benefit of the patient rather than for the benefit of the nurse. So data collection should be directed toward increasing the patient's self-awareness. Through use of observation and reflection, the nurse is able to assist the patient in becoming aware of both verbal and nonverbal behaviors. In the individual, increased awareness of feelings and needs in relation to health status increases the ability for self-healing. The assessment phase also pertains to guiding the patient through the cure aspect of nursing. So the health team collects biological data, like for example physical and laboratory, to help the patient and family understand and progress through the medical regimen. The second phase is the nursing diagnosis or the statement of the patient's need or problem area. So the nursing role influences the interpretation of assessment data and conclusions reached. So viewing the patient as the power for self-healing directs conclusion differently than if the healing powers rest in the physicians or nurse. So the patient is the one in control, the one who identifies the needs. The third phase is the outcome and planning. It involves setting priorities and mutually establishing patient-centered outcomes and goals. So the patient decide what is of highest priority and also what outcomes and goals are desirable. In Hull's theory, the core is involved in outcomes and planning. The role of the nurse is to use reflection to help the patient become aware of and understand needs, feelings, and motivations. Once motivations are clarified, Hall indicates that patient is best person to identify outcomes, set goals, and arrange priorities. The nurses seeks to increase patient awareness and to support decision making based on the patient's new level of awareness. The nurse works with the patient to help keep the goals consistent with the medical prescription. So the nurse needs to draw on the knowledge based in the social and scientific areas to present the patient with creative alternatives from which to choose. The fourth phase is the implementation. It involves the actual institution of the plan of care. This phase is the actual giving of nursing care. In the care and core circles, the nurses works with the patient helping with bathing, dressing, eating, and other care and comfort needs. So the professional nurse uses a permissive, non-directive, teaching learning approach to implement nursing care, thus helping the patient reach established goals. In this phase, the nurse also helps the patient and family through the cure aspect of nursing, working with the patient and family to help them understand and implement the medical plan. The last phase is the evaluation. It is the process of assessing the patient's progress towards the health goals. So the evaluation phase of the process is directed towards deciding whether or not the patient is successful in reaching established goals. So the following questions apply to the use of false theory in the evaluation phase. First, is the patient learning who he is, where he wants to go, and how he wants to get there? Is the patient learning to understand and explore the feelings that underlie behavior? Is the nurse helping the patient see motivations more clearly? Are the patient's goals congruent with the medical regime? Is the patient successful in meeting the goals? Is the patient physically more comfortable? Whether or not a person is growing in self-awareness regarding his or her feelings and motivations can be recognized through changes in his or her outward behavior. So the following cases demonstrated our application of Hall's work. Assessment. MJ is a 20-year-old graduating basketball varsity player in a prestigious university. Unfortunately, while on his way to his game, he was involved in an automobile accident in which his arm was crushed and his right leg was injured. There was concern about possible internal injuries, but luckily, there was none. The required surgeries have been completed for his right arm and foot. He is now in physical therapy to deal with the effects of the accident and his recent immobility. Based on Lydia Hall's theory, I divided the assessment into the three circles: the care, the core, and the cure. For the care circle, physically, the remarkable findings are his right arm is in an orthopedic device to stabilize it and encourage bone healing. He is right-handed but has learned to compensate with his left hand for most activities of daily living. He needs more minor assistance with dressing. His family has brought in a skip-on shoe for him to wear on his right foot so he does not need to worry about tying shoelaces. He is rapidly gaining confidence in his ability to provide for his own physical care. For the core circle, MJ looking at the floor tells you his nurse that he is going home tomorrow and share your observation is not looking very happy about their prospect. MJ says, "Yes, I am doing okay here, but I'm scared about getting back to school. How will I take notes and tests? It looks like I've totally messed up basketball team. I am more worried with grades. I have to do well in school or else I will not able to graduate this year. I am scared that I cannot fully use my dominant arm. I am very worried with my physical therapy." For the cure circle, the surgical incision on his right arm and right leg has healed and he is beginning to bear weight on the foot. There are no problems with hydration or elimination. Skin is intact with good turgor. All the vital signs and lab values are within normal levels. His finishing is antibiotics. For continuation, the nursing diagnosis is reluctant to be discharged associated with concerns about abilities to successfully meet academic expectations. The core circle is being utilized. The outcome, graduate graduate in college and meet academic expectations. The goals are regain use of right arm as much as possible, the care and cure circles, successful completion of academic expectation performance to be able to graduate in college, the core circle. And for the implementation, I think that the school nurse is most likely to be involved at this point. So the Planned interventions were arrange physical therapy sessions around school schedule, take notes with left hand, possibly use computer on it, arrange to have extra time for written tests, provide listening ear to help MJ. MJ is dealing with frustrations that are about to arise. And for the evaluation, using Hall's 5 questions. For the first question, yes, he wants to graduate this year and now it is likely for him to play again for the basketball team. So he has changed his focus to academics, the core circle. He verbalized his feelings and concerns on what happened to him and at the possibility that he may not regain full use of his dominant arm. He has also recognized that his initial resistance to physical therapy was based on fear, again on the core circle. The nurse at the hospital helped him explore his concern about being discharged. The school nurse helped him decide to ask for extra time for tests since he writes slower with his left hand. Now, MJ talks about how he needs to do whatever he can to well scholastically. He will do anything to graduate. For the fourth question, his goals are congruent with the medical regimen and is meeting those goals. Physical therapy has been arranged for after school. He has learned to use a laptop computer with one hand to take notes, do homework, and take tests. His teachers have been accommodating about testing time. Some have been willing to give oral tests for him, the current core circle. And lastly, physically his arm continues to be uncomfortable and his foot aches at times. As a person, he is comfortable that he is successfully refocusing his efforts to his objective of graduating to college. As you can see, you will notice that there is an interaction of the 3 aspects of nursing on the case study. On what I mentioned earlier, um, the care and core aspects are the most prominent circles that is being used on the second stage or the second part of the illness, in which the cure aspect is less prominent. So the size of the circles represents the degree to which the patient is progressing in each of 3 areas. Another case study is demonstrated as an application of Hall's work. So what are the theoretical assertions on Lydia Hall's theory? Hall's theory consists of 3 major tenets. The first is the nursing functions differently in the 3 interlocking circles that constitute aspects of the patient. These 3 circles are interrelated or are influenced by each other. The 3 circles are the patient's body, the disease affecting the body, and the person of the patient, which is being affected by each of the other circles. Nursing operates in all 3 circles, but it also shares them with other professions to different degrees. Pathological conditions are treated with medical care, which is the cure circle. Therefore, nursing shares this circle with physicians. The, the person aspect core is cared for by therapeutic use of the self. Therefore, this arena is shared with psychiatry, psychology, social work, and religious ministry. The body of the patient is cared for exclusively by nursing, which is the care. The care circle includes all intimately bodily care such as feeding, bathing, toileting. The care components is the exclusive domain of nursing. Hall's second assertion relates to the core postulates of her theory. As the patient needs less medical care, he or she needs more professional nursing care and teaching. This inversely proportional relationship alters the ratio of nursing care in the 3 circles. Patients in the second stage of illness, non-acute phase, are primarily in need of rehabilitation through learning. Therefore, the care and the cure circle predominate the cure circle. And lastly, the third assertion of the theory is that wholly professional nursing care will hasten recovery. Hall decried the concept of team nursing, which gives the care of less complicated cases to caregivers with less training. Nurses are complex people using a complex process of teaching and learning and caring for complex patients with complex disease. Only professional nurses are inherently qualified to provide the teaching, counseling, and nurturing needed in the second stage of illness. So what is the logical form of Lydia Hall's theory? Hall theory is formulated using inductive logic, moving from specific observations to a generalized concept. So first, nursing care shortens patient recovery time. Second, nursing care facilitates patient recovery. Third, professional nursing improves patient's care. Therefore, wholly professional nursing will hasten recovery. So how does the nursing community accepts Lydia Hall's theory? I divided it into three aspects: the practice, the education, and research. First is the practice. Hall's theory closely resembles a nursing model of primary care. So, an explanation for this one is that her emphasis on the professional nurse as a primary caregiver parallels primary care nursing to the extent that continuity and coordination of patient care are provided. In addition, Hall's concept of nurses being accountable and responsible for their own practice are pertinent, and applicable ideas concerns for these concepts demonstrates support for her theory. In education, Hall theory delineates definite ideas regarding nursing care provided by professional nursing staff. Also, Hall emphasizes the concept of nurses practicing as practical doctors, with an issue arising nursing diagnosis versus medical diagnosis. Issues of narrowing the divide between nursing education and service and of using nursing diagnosis as a guide for patient care rather than medical diagnosis support Hall's concepts from her theory. Further development, much research and testing of Hall theory is needed before it can be applicable and useful to areas of nursing other than long-term illnesses and rehabilitative nursing. I think in particular that theory needs to be adopted to healthcare facilities that differ from the Loeb Center for Nursing before its true impact and contribution to nursing can be judged. This step would require flexibility and change in several of Hall Main's concepts and relationships, particularly those relating to the age and illness orientation of the patient. Second, home health care is one domain of nursing in which testing can be performed to verify whether or not using Hall's ideas could decrease readmissions to the hospital. I think that home health nurses could use Hall ideas of teaching learning by using reflection to increase self-awareness. The patient was ill while hospitalized, therefore, the patient would not have learned all the information necessary for proper care at home. Home health nurses can intervene to ensure that the patient learns all the needed information for proper care. And for the critique, I divided it into simplicity, generality, and empirical precision. Hall's theory is simple and easily understood. The major concepts in a relationship are limited and clear. The three aspects of professional nursing are identified both individually and as they relate to each other in the total process of patient care. Hall designed basic models to represent the major concepts and relationships of her theory, using individual interlocking circles to define the three aspects of the patient and their relationship to the three aspects of nursing. Lastly, the language used to define and describe the theory is easily understood and is indigenous to nursing. For generality, I think perhaps the most serious flaw in Hall's theory of nursing it is limited generality. Hall's primary target is the adult patient who has passed the acute phase or his or her illness and has a relatively good chance of rehabilitation. This concept limits application of the theory to a population of patients of specific age and stage of illness. Although The ideas of core, care, and cure can be applied to patients in acute phase of their illness. The theory would be most difficult to apply to infants, small children, and comatose patients. In addition to, Hall devotes her theory to adult individuals who are ill. The function of the nurse in preventive healthcare and health maintenance is not addressed, nor is the nurse's role in the community health, but the model could be adopted. Hall viewed of the nurse as heavily involved in the care and core aspects of the patient care. Unfortunately, this concept provides for little interaction between the nurse and the family because her theory delineates the family aspect of patient care only in the care circle. And lastly, the use of therapeutic communication to help patients look at and explore their feelings regarding their illnesses and the potential changes the illnesses might cause is discussed in the core aspect of the nursing care. Although therapeutic communication is also taught to motivate patients by making them aware of their true feelings. However, reflection was the only communication technique that Hall described in her theory as a means to assist the patient towards self-awareness. This is a very limited approach to therapeutic communication because not all nurses can effectively use the technique of reflection, and it's not always the most effective and most successful communication tool in dealing with patients. And lastly, empirical precision. Hall theory has been tested at two other facilities and has been found successful. These two facilities only care for adults, mainly those over 65 years of age. Therefore, empirical precision of Hall's theory continues to be limited. Further testing in facilities not caring for adults will still be needed. For the application and limitation of the theory, Hall's theory of nursing has several areas that limit its application to patient care. The first of these areas is a stage of illness. Hall applies her ideas of nursing to a patient who has passed the acute stage of biological stress. That is, the patient who is experiencing the acute stage of illness is not included in Hall's approach to nursing care. However, it is possible to apply the care, core, and cure ideas to the care of those who are acutely ill. The acute ill individual often needs care in relation to the basic needs as well as the core awareness of what is going on and ensure understand of the plan of medical care. A second limiting factor is age. Hall refers only to adult patients in the second stage of their illness, thus eliminating all younger patients. Certainly, adolescents younger than 16 are capable of seeking self-identity. A third limiting factor is a description of how to help a person towards self-awareness. Like I said and mentioned earlier, the only tool of therapeutic communication Hall discusses is reflection. By inference, all other techniques of therapeutic communication are eliminated. This emphasis on reflection arises from the belief that both the problem and the solution lie in the individual, and the nurse's function is to help the individual find them. But reflection is not always the most effective technique to be used. Other techniques such as active listening and nonverbal support may be used to facilitate development of the self-identity. The fourth, the family is mentioned only in the cure circle. This means that the nurse's contact with families is used only regarding the patient's own medical care. It does not allow for helping a family increase awareness of the family self and limits the use of the theory to the individual as the unit of care. And finally, Hall's theory relates only to those who are ill. This would indicate no nursing contact with healthy individuals, families, or communities, and it negates the concept of health maintenance and healthcare to prevent illness. Basically, for me, Hall's theory can be readily applied within the confines of the definition of adults past the acute stage of illness. However, this is too confining for a total view of nursing, which includes working with individuals, families, and communities throughout the life cycle and in varying states of health. However, it should be noted that a nurse who uses Hall's theory functions in a manner similar to the method of assignment known as a primary nursing. Considering that Hall instituted Loeb Center in the early 1960s, her ideas certainly provided leadership and innovation in nursing practice. She also deserves praises for having the courage to create a new environment in which to put her ideas into practice. And for the desirable consequences, the theory provides a general framework for nursing, and the concepts are within the domain of nursing, although the aspects of cure and core are shared with other professionals and family members. It does address itself to pertinent and contemporary issues of accountability, responsibility, and professionalism. Application of the theory in practice has produced valued outcomes in all three areas. And lastly, the theory demonstrates a great impact on the educational preparation of nursing students. In summary, Hall's theory of nursing involves three interlocking circles, each representing one aspect of nursing. The care aspect represents intimately bodily care of the patient. The core aspect deals with the innermost feelings and motivations of the patient. The cure aspect tells how the nurse helps patient and family through the medical aspect of care. The main tool the nurses use to help the patient realize his or her motivations and to grow in self-awareness is that of reflection. Of the major concepts in nursing meta-paradigm, only nursing is defined as the function necessary to carry out care, core, and cure. Hall presents a philosophical view of humans as having the energy and motivation for self-awareness and growth. Definitions of health and environment must be inferred. Where theory can be used, nursing process, the core, care, and cure aspects are all applicable to each phase of nursing process. The limitations of Hall theory, illness orientation, age, restriction on family contact, and use of reflection only can be overcome by taking a broader view of three C's and by emphasizing the aspects that are most appropriate for a particular situation. So these are my references for my presentation. These are for the books. My references, the websites. This is my mind map that I used for my